Okay, we'll go on and get started today. We're going to record this session, so I will wait for Hannah to get it recording. Oh, is it recording? It
It's
might be.
recording, yeah.
Okay, perfect. Sorry, I did not see the little button. Hi, everyone. My name is Lauren Robinson. I'm the liaison to the College of Medicine, and I'm presenting with my colleague. I'll let her introduce herself.
Hi, everybody. I'm Rebecca Morgan, and I am the liaison to the College of Pharmacy.
Today, we're going to be talking about how to choose a review methodology. So which type is right for you, and it's going to be a flow chart for you. But before we get into that, I want to take a moment, and we have one more workshop coming this semester. And it's why a protocol and how to get off to the right foot in a review. And that's coming on November 30th. So please register for that if you're interested, but the recording will be available. So even if you can't attend and you want the recording, please register and we'll get it to you. One other thing, this is just a guide that we have here at the Medical Center Library. It's the Systematic Review Guide. And we'll be uploading this video here. And then I will put the link in the chat as well for everyone. And there's a lot of really great resources and tutorials and other documentation and other templates available here for you. So we really recommend checking out this resource as well. So now we're going to get into how to choose a review methodology.
Right, let me go ahead and share my screen. Just a moment. Right, is everybody seeing the infographic? Yes. That we have here. Okay, so we are going to structure this presentation by going through this infographic, this kind of flow chart, to help you determine what review you want to select based on the methodology, the end product you ultimately want to have. We're going to work through this point by point, and then at the end we're going to leave time for questions. So if something really that you truly don't understand, you have a major question pops up, then please put it in the chat. But for the most part, we would like to just kind of work our way through this and then save questions for afterwards, if that's okay with everybody. Okay, so let's start with choosing the right review method. Okay, so the first thing you really need to ask yourself when you are thinking about starting any type of literature review, advanced review, is, are you planning on having this being a truly comprehensive review that is gathering all the evidence on your topic? Are you truly wanting this to be fully comprehensive, where you're going to be synthesizing the data, doing all that work, or do you just want kind of a snapshot of what's out there? And if the answer is no, then you can still do a simple literature review. I feel like a lot of people feel like literature reviews are now like a thing of the past. We shouldn't be doing literature reviews anymore at all because we have systematic reviews, we have advanced reviews, when really there is a place for the classic literature review. The thing that I think you need to keep in mind with them is that they are usually based around broad questions, whereas advanced reviews are based around very specific clinical questions. The searches are not comprehensive, but they can be. There is no guided methodology for a literature review. It can be done very systematically, very methodologically, but it doesn't have to be. And the main goal of it is to just summarize the literature on a topic. But you need to remember that because there is not a set methodology that is based around removing bias, that bias can be inherent in these types of reviews. Lauren, do you have anything to add about that?
No, you covered it.
Okay, so let's go back up. Oh, I'm sorry, I went backwards through this. And let's say that, yes, in the flow chart, you are planning on gathering all evidence on your topic. The next thing you need to ask yourself is, I think the biggest stumbling block, and Lauren, I'd be interested to hear what you have to say about this. I think this is probably the number one stumbling block for patrons when they come to me with an advanced review request, and that is, do you have a well-formulated research question? Because so often we just have people come to us and say, well, I have this idea on a topic. I just want to know everything that has ever been written about topic X. And you need to know, if you're going to figure out what kind of review you want to do, you have to have a well-formulated research question. So let's start with saying, no, I do not have a well-formulated research question. What do you do? Lauren, do you want to take this?
Yeah. So I agree with what Becky said. Like people often come and they don't have a really formalized question. And if you don't have a formalized question, you are inserting bias into the review process, right? It's not following the scientific method where you have a hypothesis you're testing. So we really recommend, can you click the arrow one more time for me?
Sure.
We really recommend using a framework for this. And this is an article that I liked showing. It's one of the MUN articles available on our systematic review guide. And it really breaks down all the different frameworks you can use. The most common one is PICO, right? And that one falls really well for systematic reviews. But there's a bunch of other ones, and a PICO doesn't really fit if you're looking at like a prognostic type of question. So usually we recommend looking at these frameworks and really honing in what you're trying to answer and what type of question you're looking at, because that's going to affect what type of review methodology you ultimately choose.
Absolutely. And I mean, the bottom line is that when you're doing an advanced review, the end goal is to have a reproducible search. And in order to have a reproducible search, you need to have a clear question that can be searchable. And so you have to have this well thought out research question as a starting point. Okay, so now, do you have a well formulated research question? You've thought it out. I'm sorry, I keep doing that. Sorry, Lauren.
It's all good.
Yes, now you do. The next thing you need to ask is your timeline. Do you have 12 to 24 months to complete the review? That might seem like an excessively long time, but really, I actually think in some cases that might be a minimum. I've had reviews that go well beyond that just because people underestimate how much time they have based on the rest of the other work they have to do while they're working on this review.
Right. Yeah, 100% agree. So if you don't have that time, we recommend a rapid review. So what is a rapid review? So it accelerates the process. If you're doing a true systematic review, for example, if you're following all the strict guidelines for them, you should be looking at data sets. You should be looking at conference abstracts. You should be looking at prospective studies and registries. And that takes a whole lot of time. Again, it doesn't fit every review methodology, but if you're doing like a true systematic review, and I would say most people don't actually do all of these kind of gray literature areas when they're doing systematic reviews. And it actually kind of follows closer to a rapid review. Rapid reviews do not require you to do that. They don't require you to look at prospective research. They don't require you to look at conference abstracts. And that takes a lot of time because that data is not easily accessible. Prospective studies are one of the hardest things to find because there is no mechanism for mapping that clinical trial data or that clinical trial ID to the ultimate published research. We have to remember that research that is published has an inherent bias because positive results are published. So in order to counteract that balance, to do a true systematic review, you're trying to counteract that balance, you have to include those prospective studies and the data that might be available from the researcher. Rapid reviews kind of go around that and you don't have to do it. You can actually kind of decide what your scope is. If you're going to include conference abstracts, if you're going to include prospective research, like where is your lines? And that really speeds up the process. It's still systematized. It still has the same transparency requirements, the same reproducibility requirements. So just be aware that this is kind of the workaround. And I would say a lot of the ones that most people do are really rapid. reviews, even if they are called systematic reviews.
And so there is an interest probably in being more upfront about how, if you are not going to do these things, maybe consider calling your systematic review a rapid review if that is what it truly is.
Yes.
Right.
And I would say that we like I would like, as a professional who does this a lot, I would like to see more titles of articles who are actually saying what review methodology it is. And we run into this, like some journals want it to say systematic scoping review or whatever it may be. It's all systematized. They all have the same like rigor. They're following a set methodology. But I would like to see articles and journals really take that and say, this is a scoping review, this is a systematic review, this is a rapid review, just to throw that out.
I agree 100%. So yes, you have thought about your timeline. You do have 12 to 24 months to complete this review. You want to do the full process. So now you need to ask yourself, this is another big question that I come across with a lot of patients is, and this also comes down to the type of question that you're asking is, are you actually looking at a specific, clinical or interventional or therapeutic issue, or are you scoping the literature? Is your topic actually quite broad? Are you looking at a new area of research and just trying to see what's been written about it? And if yes, then definitely consider doing a scoping review. And the idea behind a scoping review is to identify the types of available evidence in a given field, clarify concepts and definitions in the literature, and to basically fill and analyze knowledge gaps. And one thing I will say about scoping reviews is that they tend to be broader because they're looking at the scope of the literature. And as a result, the searches can often tend to be broader. And as a result, the results that you get back can often be broader. So scoping reviews can take longer than other review types because you do get more results back in some cases. Of course, that's very variable. It's hard to make definitive statements about any of this, but in my experience, that's often been the case. Lauren, do you have?
Yeah, I would add that like most questions fall into the scoping review category. I would say probably 80% of the ones I assist with are scoping reviews. And I run into people who who think they're not as like high quality as systematic reviews. They are. It's just a different methodology. There's actually 2 articles that are available on our systematic review guide that actually laid the foundational methodology for a scoping review. The most recent one is the Levack article on our guide. So like it's just as rigorous as a systematic review. It's just how you analyze the data is different. You're not doing as much quantitative analysis. There is some in a scoping review, but you're usually mapping and you're doing a thematic analysis and trying to fill in gaps and things like that. So I would just say like they're just as rigorous as a systematic review. It's really the analysis that is different.
And oftentimes scoping reviews need to be done to determine topics that can become systematic reviews in the future. So often they are a first step in identifying these knowledge gaps and areas to determine future research areas for later on. Okay, so moving on, if it is not a broad scoping question, the next thing you need to ask yourself is, are you wanting to include and review only systematic reviews about your topic? And that might seem like kind of an odd question to ask, because when you're doing a systematic review, you should be searching primary literature. And this question is asking, do you only want to search systematic reviews or secondary literature? And that is because of a type of review that I don't think many people are as familiar with. Would you agree with that, Lauren?
Mm-hmm. Yes.
And that is the umbrella review. So if you are only interested in looking at what systematic reviews, basically doing a systematic review of systematic reviews, that's an umbrella review. And they are one of the highest levels of evidence, and they're the best way to specifically compare interventions and guidelines. But of course, this can only be done if enough reviews and guidelines have been done on a certain subject. So it's fairly self-limiting based on the amount of evidence and prior research that is out there on a topic.
Yeah, and it's newer. And there's been, I'll take this moment to talk about, like, in the literature, there's more and more people speaking about the quality of systematic reviews. I remember when I was a student, those were like the highest quality evidence, right? And now the quality of them, because so many people are doing them, is dwindling. They're not following some of the rigorous standards put out. So the umbrella review has become more popular because you're wanting to analyze the systematic reviews and appraise them themselves in order to find the best evidence. So I think that's one reason these are growing in popularity.
Yeah, that's a great point. That is an ongoing problem that is increasingly being addressed. And the only way that you can truly compare and gauge the levels of evidence in these reviews is by doing a process similar to this. Okay, so if you're not wanting to only review systematic reviews and essentially do an umbrella review, then you're choosing a systematic review. And the purpose of a systematic review is to confirm practice, address variations, identify new practices, really identify the totality of the literature internationally and nationally as well, not just limit it to a certain geographic region. Identify and investigate conflicting results and try and figure out what happened there. And then also, the driving force of them should be to guide clinical decision making.
Yes. Yeah. And this is often, most questions that we work with people on don't fall into a systematic review, but that's what everyone wants to do, right? I would say systematic reviews do really well for PICO type of questions, right? When you're comparing two interventions and you're wanting to know which one is better. That is what a systematic review is for. It's a comparative process, an appraisal process of all of those primary sources. Again, you can include systematic reviews in when you're doing systematic review, but you can't include that article. You actually have to go and pull out all the articles they included and include that in your systematic review. So again, you're not including the systematic review itself, you're including all the articles it found. So just be aware, like, you might see that when you're looking at these type of methods as well.
Yeah, and as Lauren says, systematic review, and we've alluded to this through the whole presentation, it's just become kind of the catch-all phrase for any kind of advanced review. That's why we have a systematic review guide when it's really an advanced review guide. And so hopefully this presentation has provided a little more clarity about the types of reviews and how to select when to choose them. Now, the final question that you really need to ask yourself once you've decided that you're doing a systematic review is, are you going to use statistical methods to collate data from included studies and objectively summarize the results? And if not, then you will not be doing a meta-analysis. I think so often we see systematic review and meta-analysis, and people assume that a meta-analysis is ultimately a required part of a systematic review. And that is not the case. But if you are going to be using these statistical methods to collate data from the studies to summarize and synthesize the results, I'm sorry. Then you will be choosing a meta-analysis.
So yeah, and meta-analysis, like Becky said, can occur with a systematic review, but it doesn't, usually it's always a systematic review and a meta-analysis, but you can do a systematic review without doing the meta-analysis because you have to have enough data, right? I've worked with teams where they are planning on doing a meta-analysis, but they get to the actual data and it can't be collated in a good way. Like, you can't make up the differences in populations well. Or there's so few articles that you can't really create a statistical significance, right? So I would say that these are not as common as just a general systematic review. And I would say you often almost always need a statistician to do this part. There's a lot of things you have to calculate to make sure you're combining your populations correctly, right? Because not every study has the same population requirements for their study, or maybe the geographic parts of it, or maybe the age or the sex or whatever it may be might affect that population and for your ultimate meta analysis. Becky, you have anything?
No, I agree 100%. And yeah, that's not a failing not to do a meta-analysis. That is an often a significant finding in and of itself about the quality and the breadth of the data that you have uncovered in the course of your systematic review. So
yeah, because if you can't do one, then you need more standardization of that research area so you can actually make better evidence-based decisions.
absolutely.
Okay. We have some references here. Some of those MUN articles I spoke about are here. Our systematic review guide link is here. It's also in the chat. All the resources we talked about with the different methodologies and things like that are available on that guide as well.